People at the heart of this project are people with learning disability who have also got a mental health condition. That could be depression, schizophrenia, bipolar disorder. It could just be really just generally stress as well. And I think certainly we were aiming to pitch this project at people who are affected by stress and how that affects their mental health. The Health Needs Assessment for Scotland clearly identifies that people with learning disability have differing health needs from the general population. And I think in amongst that assessment, there's also detail of how people with learning disability are 3 times more likely to have a mental health condition. So I think for me, there's a bit there in terms of supporting our client group and looking at this need and trying to support them with that. And as part of that, we went out and we were looking at what resources are available. And there's a plethora of resources out there for mental health conditions and recovery and relapse prevention and all that. But for people with learning disability, there's not the same amount of research, literature, tools, toolkits. So myself and my colleague who were Ewan Post, working primarily with people with learning disability and mental health in this, started to become really interested in this and wondered, well, what can we develop that can make a difference for our client group? So we went about and we had a look at different resources, and we tried to speak to people with learning disability who were in, what their thoughts on these resources were, and we kind of, tried to make things as accessible as possible, and we came up with a framework for a kind of simple poster that could be used for people with moderate learning disability, but also people with mild learning disability, because often you don't know when you're working with people where their level of disability is pitched up.
We decided to set up 2 groups, 10 sessions, to look at a range of issues around staying well, including the physical health issues, exercise, eating well, keeping active, and actually having meaningful things to do, but also look at some of the other things around mental health, about negative thinking, about how the way you think can affect the way you behave, and how the way that you behave then impacts on people and things around you, and how you can get stuck in cycles of negative thought. Bit of a challenge with our population because there's not many resources out there, so we had to do a lot of work about how we were going to do that. So we chose an interactive approach where people would actually develop their own plans. We would provide resources like symbols, signs, catalogues that they could cut pictures out of, and the process would be to talk about the things that made them well, the things that made them unwell, and how we move from being well to unwell and back again. So that's why we decided to use this format. And each person, even the support staff and the family members that attended, and myself and the other facilitator, both did our support plans as well. The aim was that people would then take them away and share them with the people that they live with, their support systems, and to be able to look back and reflect on them and learn from them. Then at the end of the group, we did some evaluation work. We got people to look at their plans and to talk about their plans to each other. We did that at the end of the group. And it was quite enlightening how much people had learned in the process, including the support workers and the family members that were present as well. So that was our process really. It was about planning it, implementing this interactive groups, and then evaluating it at the end. The important thing for us was seeing how people with learning disabilities began to interact with the materials that we were showing them. And we had other people from the multidisciplinary team that came to help us. We had physiotherapists come to do about activity. We had occupational therapists come to talk about activity, in meaningful activity. We also did some interactive work around healthy eating, and the amount that they contributed to the process was amazing, and what they took from it. And actually seeing that some of the group members, family members and carers were learning from their sons and daughters during that process, which was really good to see as well, that everybody was getting something out of it. And I think that was the biggest thing we noticed, and the biggest reward for us was to see that going on. I think the group setting really helped that. It gave people a voice, whereas it would be more difficult in one-to-one interaction to do that.
The best thing about being involved in the project is actually being a bit about the ability to kind of link up with other allied healthcare professionals, to be working with individuals with learning disability and their families. It's been about this collaboration that we've kind of all pulled together, and although everybody's had their own individual goals within that, it's been kind of like a group, a sense of feeling in being together on the same journey. So it's been very journey led, I think, for everybody.
We learnt a lot from doing the groups, and we learnt a lot from the people talking about what they'd learned, what they'd found difficult, what they were going to go away and use, and maybe the things that they weren't going to go away and use. And that has enabled us to work closely with other colleagues within our service that are looking at developing accessible information around wellness planning, around crisis intervention, to be able to take what we've learned from our evaluations and how that will fit in with the work that they've been doing. And we're hoping to progress that to developing materials that are accessible for people with learning disability, but also having it out there for family members and for carers to be able to look at the documentation and use it to help people stay well when they have a mental health condition.